Hello, everyone, and get ready for an exciting episode. This week on the Beauty Biohacks, we welcome Dominik Thor, a leader in longevity science and regenerative medicine. As a president of Geneva College of Longevity Science, GCLS, which I have just enrolled this year, he is shaping the future of longevity educations and make it accessible for all industries and all people. So this CEO of Tomorrowlabs, he turned cutting-edge research into real beauty and wellness solutions. So with a background of biomaterials, skin and hair rejuvenation, and medical innovation, Dominik is here to share game-changing insights. So if you care about beauty, wellness, and longevity trends, don't miss these episodes. Welcome, Dominik.
Thank you so much, Irina, for the nice introduction and the kind invitation. Very happy to be here. I think it's tremendous what you are doing for the industry and also for longevity science by really, helping to connect industry experts with scientists. I think this is a very good way to work together.
Thank you. And back to you. Tell me, what made you take this bold step to create a college dedicated to longevity science?
Well, there were several moments in my life when I've been working with amazing universities, medical universities, but I still saw a certain limitation to what they can do in terms of their education, because they have a very clear job description, for instance, which is educating medical doctors. And the field of longevity science, and I'm sure we will be discussing this today many times, is an interdisciplinary one. So it really is not just medical science. It's nutrition, it's exercise, it's sleep, it's psychological factors, many more. And traditional academia is somewhat limited because of this clear job description. They need to focus. And so I figured at some point, well, there are so many self-declared experts. Some of them are actually good, but many are not. So I think it would be a great idea to have academic education. This field really needs it. And only by doing so, we can fully realize its potential.
Yes, absolutely. I totally agree. And I'm so excited about covering all these 6 pillars which you cover in the college. So, but let's talk about longevity science. It feels like a buzzword at the moment. It's everywhere in the press and social media. But what does it exactly mean, and why should it matter for the industries like beauty, wellness, technologies?
Yes, it definitely is a buzzword, and there are good sides to that and not so good ones. I think it's getting watered down and people may misinterpret what it really is about. And basically, if you don't remember anything from today's talk, please remember this: longevity or longevity science or longevity medicine or healthy longevity, so lots of different names, but it has basically 3 dimensions or 3 goals. So the first is what you might expect from the word. This is the increase of lifespan. Yes, of course, we hope to live longer through these new technologies. But more importantly is the increase of health span. So the years that we spend in full health, being able to do what we love and go, through daily life without being impacted by age-associated disease, this increase of health span is maybe the most important goal. And it is really linked to the third one, quality of life. So these 3, the increase of lifespan, the increase of health span, and the increase of quality of life, this is what longevity science is all about. And of course, this thereby affects all other industries, because it really affects how you go about when you talk about beauty and wellness, and you need technology to realize this.
Yes, exactly. That was my next question. The next question: how this affects longevity science affects the beauty and wellness technology industry, and where do you see the major shifts in these industries?
Yeah. Well, I guess it's on many levels. So I think first and foremost, the beauty industry and wellness industry has always been very clever to associate itself with luxury. So whether that's superstars that you use as testimonials, or wonderful places where you have these wellness centers and luxury hotels. And the biggest luxury that we have is time. So anything that is able to bring us more time, and I deeply believe that what's happening in longevity field, we are still at the very beginning of this. This is going to help us to bring us more healthy life years and maybe additional life years. And of course, other industries want to be associated with that. And there is an aligned interest between this because medical science, again, needs these other factors to be right in order to do its thing. It cannot exist on its own. You have to think about nutrition and exercise and regeneration and many of these things. And technology is what really allows us to better understand our bodies now, to generating this massive data for which we may need AI to make sense out of that. And beauty is important because when you feel younger and invigorated and more active, then you want to look the part. Nobody wants to look in the mirror and say, oh, I feel like, I don't know, a younger person. But when I look in the mirror, I don't see myself. I don't recognize myself anymore.
Yes, exactly. And when you feel good and when you are healthy from within, there are a lot of study I've read that your appearance is also changes for the better, right? Your skin look more radiant, and so like it's totally
It's
connected, right?
yes, the psyche and how you feel is so
Yes.
important on many levels. You will be more healthy. And actually, there are medical drugs that have been filed with the FDA with the clear intent of making people more happy. So this is a true story. There is, of course, Botox, which is very famous. And then there have been other substances that basically do the same, right? So they reduce wrinkles by essentially working on the nerve systems and thereby reducing your muscle movements in the face. And by not looking so angry all the time, other people respond to you in a more friendly manner. So you don't look grim, they smile at you, you smile back, you're more happy. And actually, this making people happy has been the grounds for FDA to approve another Botox-like substance a few years back. So it's
Yeah,
interesting. It will
I
play an
know.
important
There are a
role.
lot of talking about like even plastic surgeries and stuff like that. It's like it's not just about the how I look. It's about make me look the way I feel, right?
Yes.
And like young, make me feel young. So it's so connected. All this like beauty and health is so connected. It's crazy. So you're talking about like we are just in the brink of this longevity and innovations. If you look like 10 years in the future, like do you see like any kind of breakthrough that you think like will disrupt these industries?
There's so much going on in terms of science. If you look at the number of papers that are being released, the many projects now, the big companies are entering the field. So I'm sure they are cooking up very interesting things. So maybe to hedge my bets and not to say, oh, it's this one or the other technology, I would rather say it's the ultra personalized therapies of any kind that doesn't have to be medical. We see it in other fields too, that people start understanding that humans are individuals that work differently, and you have to take this into consideration. And now with the new technologies, as in AI and diagnostics that we have available, the gadgets, whatever, we can suddenly start making products or therapies for individuals that are very, very specifically tailored towards their needs. And I think this trend will continue and it will happen on many levels and in many industries.
Yes, interesting. I remember when in the beauty we started with personalizations trend by just people were filling in the questionnaires online so that they try to adjust the skincare or whatever they need. And then it's become like mobile apps scanning your face and telling you what skincare routine you need. And I was thinking like, okay, how far? What is the next step? How far you can go? But ultra personalization, that's very, very interesting because in the end, we are all so different, and it's very hard to put us in like 6 or 10 or 12 boxes or something like that, right? Yeah. So tell me, is there like anything? Is there like innovation or discovery in longevity science that you think like massively underestimated?
Not so much maybe in innovation, but in discovery, because we are always discovering, or we continue to discover the many ways that you can positively affect your health as you grow older by looking to eat clean, to do sports. So nutrition and exercise, if I may be so cynical, are the most important factors that people forget about. So they are aware of it. Everybody knows we should be doing it, but they still decide not to do it. So this is a problem. But of course, when you look at the question from more what's happening in terms of research, well, then there are several hallmarks of aging, contributing factors to aging that people, scientists have defined that have been in as a major focus in beauty, like cellular senescence. Maybe I'm more in favor of addressing inflammation. So chronic inflammation as you grow older as a organism-wide issue, right,
Yes.
arising in all different kinds of tissue, is interesting because it really is something that is driven by other hallmarks of aging. So if you have something that addresses inflammation, as it's called, inflammation as
Information.
you're older, then the chances are very good that you actually address several hallmarks. So I think that is interesting, but there are also a number of regenerative pathways, such as the one that I've been working on, the HIF1 alpha pathway, that deserve more attention. So there is a lot happening in this field.
Yes, yes, very interesting. And I have to tell you, like, science is great, and I'm very interested in science. This is one of the reasons I have enrolled in the Geneva College of Longevity Sciences. But my background and my network is more like industry and practical. So one of my goals is actually to see how this longevity science, which is very important, but how it translates to the products or services or technology, what will make it difference. Do you have any examples for that? Actually, I have some examples, but maybe you have some.
Well, certainly. I mean, there is new things coming up all the time. We hope that they are not just using the term for marketing, but they actually have an improved product, something that does something that hasn't been available before. I mean, I've been working on developing products in the field of cosmetics and medical devices for some time now. So there are several things out there, but I'm maybe most excited about the many new longevity clinics popping up, because these are places where these technologies are being applied, and I think they could be also interesting to other industries, because when you look at dermatologists, for instance, they do use skincare, and therefore I think these clinics can be places where patients get in touch with new technology, whether that's wearable devices, skincare, whatever, medical innovations, of course. So I think they combine very cleverly this new field of diagnostics, using AI to make sense of data, and creating this ultra personalized therapies, which not just include medical intervention. Again, they can be very often include supplements. Supplements is a big part of the industry right now, I think, also in terms of the money that is being made with it. So yeah, there's a lot happening.
Yeah, exactly. And with supplements, for example, I see how industry moving from just like vitamin C and antioxidant, blah, blah, to NAD plus, and yeah, all this kind of interesting new ingredients which longevity scientists would find, right? So it's definitely there is like a big shift into longevity trend with that. So now let's talk about like wearables, biohacking, personalized health. Tell me, like, what is the hype and how much is, really transformational? What is,
Yeah,
how much?
very good questions. Of course, whenever something happens, people are start adopting the things that are the trendiest, the coolest. And of course, in technology, development cycles are much shorter than when you look at drugs or medical devices. So therefore, there are new apps popping up, and I think a lot of them are very useful. They're maybe not, as you called it, transformational, because the data that you can collect from your smartphones or your smartwatches is interesting health data. But when it becomes very specific, you either need a new device, or maybe you have a regulatory issue because it's actually has to be controlled by the FDA. So the typical things that you collect, like how many steps you have taken, or maybe your, I don't know, the amount of sleep that you got during the night, it's
Fluctuate,
interesting. Yeah, it's
but
interesting.
it's very useful, actually. It's kind of help you to motivate, right? A little bit
Exactly.
for
I think
reaching your
that is
goals.
the most important thing. So there is, for instance, continuous glucose monitoring, these patches for people with diabetes. So they are transformational because they really give you something that you haven't had before, the opportunity to react at the best time for you. But the rest, maybe it's important from a psychological perspective because it gets you going. It shows you, oh, you could be doing more for your health. So I'm all for these other apps, even if they are maybe a little bit more gadget-like and not true new science, but they can be useful.
Yes, exactly. Is there something like, what do you think about the most exciting and untapped opportunity for the beauty and wellness in the longevity space? Is there something which we have not yet?
Yeah, well, I think that longevity in itself is a huge chance for beauty and wellness because in the end, as we said before, when I change the way that I feel because I'm more healthy. I can be more active. I can continue to do the things that I love. Maybe I'm even working longer. I'm doing more sports. I'm having an exciting social life because I can still do it even if I grow older. Then of course I will be looking into things that are related to beauty and wellness because I want my outer appearance to reflect how I feel inside. So I think it would be a good way to focus on this because sometimes I get the impression that the beauty and wellness industry right now tries to replace science or medicine, having some claims like, oh, you don't need Botox, you just use our skincare. Maybe it would be better to focus on science and be a bit more open and honest in the communication and say, oh, we can augment what's happening, right? Because longevity, it's not one or the other, it's everything happening at once and helping each other out. So I think there is a good way to work together. And by accepting, doctors, I'm not saying they should be role models here or testimonials, but understanding the place of doctors and medical science in the field of longevity can also give the industry maybe some new access points for new customers, because the doctor can only do his part while the patient is visiting. And then when the patient goes back home, they have their routines and they need the right products, the right apps, whatever, to help them stick to these routines.
Yeah, and with social media dominating the marketing, the consumers see some things and they are very skeptical sometimes. So for the brands, for the beauty brands, is very important is to build the trust. This is all about trust. So would you suggest like collaborating and working with the doctors and scientists would be the way to build the trust, or what would you
Well,
suggest?
certainly, I think it's a very, I would say, powerful way to show that you have a unique and a superior product if you can work out some sort of collaboration with a scientific entity or a great doctor. I mean, the risk always is that the consumer, that the messaging gets too complicated for consumers to follow. So if you have a scientific advantage, which I always endorse, and I think that's wonderful, and we are happy to help companies come up with something like that as scientists. But at the same time, you have to think about communication, and people, if they have just a few seconds to decide between two products in a beauty retail store, it will be very hard just from looking at the packaging whether something is really as good as it claims. So messaging is important, and I think it has to be toned down and realistic, because you can have a great product by not making any bogus claims, right? So maybe not claiming, when we talk about longevity, not about your skincare increasing life expectancy, focus on some supportive effects, and this would be good. So a good example would be when you talk about fitness. There are lots of nutritional products that say they improve your fitness. Well, I think under the right circumstances and with the right formula, they can help you to build stronger, leaner muscle. And as you grow older, fighting sarcopenia, so gradual muscle loss that you experience as your body goes through a continuous aging, is important. So you retain your grip strength. You can do things from daily chores like going shopping, but also doing sports. So it's a continuous cycle, and you need this. So I think you can make credible claims and have a good, clear communication. This is what's important to build a strong connection with the consumers.
Yes, exactly. There's so much miscommunication, actually. Let's speak about longevity science and misconceptions. Is there is like one single misconception about longevity science that we
Oh,
need to
yes.
address?
Oh, yes, it has to do with the terminology problem that I mentioned before.
Mhm.
People that have never heard about it sometimes say, well, I'm not interested in living so long because I know it from my parents and my grandparents. They spent all their last remaining years being afflicted by age-associated disease. They didn't feel well, they weren't happy. So I don't want to have that for myself. And that's the thing, right? Longevity is about increasing health span. So making the most out of the years that we have and maybe win some additional years. So I think this is the biggest misconception, that this is science that only deals with prolonging life, irrelevant of the quality of this life. It's about increasing quality of life.
Yes, that's absolutely agree. Yeah. So now back to industry and longevity and industries. So it feels like the best ideas comes when different industries collide. So what do you think like beauty, wellness, technology can learn from the healthcare, pharmaceuticals when it comes to longevity?
Well, so I think it's very important that they have to work together. They have to follow, like scientists do, a very structured, no nonsense approach to science. Because if we talk about longevity, we are making health claims essentially. And this is good. But of course, beauty is a very personal thing. So you can say, oh, this is the most beautiful product ever. And maybe it's true from your perspective and somebody else feels totally different. But when you talk about health, this is more of an absolute thing, right? So you're either healthy or you're not, and there are some clear medical indicators for that. So when we talk about longevity and health, I think we should be a bit more focused on what's really working, on science. And I think the good thing about it is that when you have a good product that does what it promises to do, you will see repetitive purchases from the customers. So the consumers will feel they are earnest in what they're doing. They don't promise too much, and they will not feel taken advantage of. I think that is very important. Consumers are not stupid.
Yes, exactly. So what makes these collaborations successful, when beauty and science collaborate together? What's the key to success, let's say?
Well, I had the great joy of working with some of the bigger names, or working. Sometimes we just had very friendly discussions about new ideas that we wanted to help them come up with. One of the problems is that, of course, any organization, and I'm not dropping names here, and not individual people that I have in mind, any organization tends to have a not invented here syndrome. People have been working hard, finding out new stuff, and suddenly there is a guy or a group of researchers or any institute, could be GCLS, claiming, oh, we got something new. So this makes people skeptical, because they ask themselves, why haven't I come up with this idea, and can it be any good? And maybe we have to admit that the rest that we did wasn't so good, not just on an organizational level, but we as a group of scientists working for that company. So overcoming this not invented here syndrome and being open for new ideas, I think, is key. And I think the organizations, they have to understand that we are talking about a new field of science here. So while, of course, clever people with a solid background in medicine, biology, chemistry, whatever, they can work their way into this, absolutely. But I'm sometimes amazed that you see experts being created just out of necessity. So there is some guy that has been doing something, and suddenly there is longevity here, and they are director for longevity, having no real clue about it at all, but just being promoted to this so the company can say, oh, we got this covered. I think that's not a very clever strategy, because in the end they need the best products, and for that they need great minds. So maybe they should look outwards and use the experts that they have for the things that are also being required. So longevity is not replacing other things. So I think all in all, education is important here. This is why GCLS, I think, can be very helpful, not just in a medical sense, but also for the industry, because we educate these experts, and
Yeah.
people, clinics, companies, they look towards us for getting the manpower to address this big trend.
Exactly. And like from my experience with collaborations, I think one of the keys is also to focusing on long-term vision rather than the quick win, let's say, right? Working together with institutes or doctors, not just like for one discovery, but just like more
No,
long-term.
you're right. I mean, of course, academic institutions, they have different things they're looking for. So they have also different timeline in mind. Things move a bit slow. When you are part of the industry, you have to be a fast mover, an adopter, and an early adopter. So there is, of course, some difficulties in working together.
Yeah,
I think this has to be aligned in the beginning, but then it can work.
exactly. Okay, now let's talk about biohacking. So how much, like I'm consider myself a little bit of biohacker.
Yeah.
But there is some pros and some cons, right, about it. So how much is it fed and how much is root into the science? Maybe you can tell.
Well, I think biohacking, as in the idea of better understanding your body, applying a structured approach to optimizing it, is a great one. So this is, I think, a very good idea. Everybody should be listening to his own body and see how it reacts, and then eat and work out accordingly. I think one problem that I see with the terminology of biohacking is that it's so trendy that it's also, I think, somehow very much linked to social media. So we have these experts that share their insights via social media. Now, this is what makes me as a teacher a bit skeptical sometimes, because with social media, you have sometimes very short messages, just a few seconds of video, and there are things being repeated there that can be untrue, or it may be actually true, but it's just simply too short an information, and it maybe doesn't focus on side effects or any potential issues there are. So whenever you have things that affect your health, I like people to go see experts that have enough time to really focus on this. And an expert doesn't have to be necessarily a medical doctor. When we talk about biohacking, mostly relates to things everybody can do: physical intervention, nutrition, exercise, etc. But again, one has to be very careful about the source and also the way of communication, because again, just a short reel on social media might not give you all the information that you need. So I prefer science to be clinically tested and safe and effective, and then being advocated by a person that has all the knowledge plus all the time required. But yeah, it can be very good and it can be very bad, as all things.
I have an example of that, actually, the bad one. Some years ago, I don't want to mention what blog I was listening to podcast, and they were talking about the different sleeping pattern. That there are some geniuses in the, I don't know, Einstein was one of these geniuses in the, they were sleeping very, very little hours. And actually, in fact, they were sleeping like 3 hours sleep, three hours awake, 3 hours sleep, 3 hours awake. There are several different types of sleeping pattern. And I thought that I'm going to try it. I'm going to try it. So I tried like 2-3 days of this, like, I would wake up in the middle of night and I would stay awake, and then I would sleep again, and something like that. And I, at the end, after, and when I'm doing something, I'm really committed. I am like going through, I'm pedaling through. I remember in the end of like a second or third day, I literally thought I'm gonna die. I could not see things. I could not think of things. And now I'm thinking, okay, I think I'm gonna break it. And now when I'm thinking why I suffer so much, why I did this to my body. Now when I learn about importance of sleep and me depriving the sleep, because I hear that's good for geniuses or something.
Yeah, I'm not sure whether that information was actually correct.
Oh,
So
it's
maybe
silly.
maybe they did sleep little, but it definitely is not helpful from a health perspective.
Yeah,
So
plus we are all different. Speaking about
yeah,
all different,
these guys, sometimes they have to come up with something catchy.
yeah,
So I think, I'm not sure they make it up, or maybe
yeah,
they think they remembered from somewhere, but it's hard to follow up on the sources. And this is a good reason why we like, science, where you have
yeah, exactly. I probably got
scientific
older
articles on YouTube.
biologically for a couple of years during this
Yeah.
experiment. But anyway, speaking about personalizations, like we're all different. So personalization is like big right now in beauty and wellness. It's been big already for for a couple of years, I would
Yeah.
say. So how close we are for personalized longevity solutions for everyday consumers? Like I want like special for me. Tell me how
Well,
close we are.
we definitely have that, as you rightly said, in many industries. So you have the personalized workouts. Almost everybody does that. When they go to the gym, they have a trainer maybe in the beginning, and they put together something that should be working for you. Then very often we have the personalized meal plans, the personalized supplements, the personalized skincare. I think, as in all things, the problem here is there has to be sort of a balance. So these products, they have to be carefully manufactured. When we talk about supplements, for instance, or skincare, it's not something that you can do on your own. There has to be a process behind it, very often regulated through certifications, etc. And changing formulas on the go makes them maybe go bad more quickly. So it's actually very tough. And the question is the added value for the person that buys it really worth this additional hassle? Or can you even do it in a proper sense? Or is it just marketing and hype, and then the consumer gets disappointed? So I think it depends very much on the product, whether this actually makes sense, or if it's just a ruse to get more attention to your brand. And maybe you don't need that. Maybe you have some other good USPs that help you catch the attention of consumers. So I'm not saying that you always need this personalization. You need it when it comes to therapy, because you have to make diagnostics to better understand the patient, and then you have to put together a plan. But not every product needs to be personalized.
Yes. Yeah. So now imagine for a moment that you are a beauty or wellness brand, right? So what is there is one things you should start doing immediately to future-proof your business, just to make sure that you're not going to be out of date in the next year or
Yeah.
so?
Well, I think that longevity as a concept, as I said, has to do with health, obviously. So we are replacing claims when we look at it from an industry perspective, from making people more beautiful, let's say, to making them more healthy. I think this is a big chance. Again, it's less subjective, it's more objective, so you can measure that. This is always good. You can make any client happy when you show them a clear before and after. It's hard to say, oh, you're now more beautiful, because it really is in the eye of the beholder. But feeling more healthy, that is something that they can feel or that they can measure if they lose weight, if they got fitter or whatever. So I think that is great. Then when we talk about this objectivity, we also have to talk about communication, maybe being a bit more transparent, open, honest, and direct. And we can change, content of the communication, the language, and the substance. We can use different ways to communicate. I'm not saying we need to use a doctor as a testimonial more often, maybe for completely different products than we used to already, but it can be interesting. And I think this will be something where, a lot of experience will be made over the next few years of how to interact with your consumers in a way that, motivates them and helps you to highlight the USP of your products.
And for that, I would say, in order to really lead the right way, education. And education like Geneva College of Longevity Science, for example, this is a great path in order to make sure that your brand understand all the.
Yeah, well, I think education is on many levels important. So we are always very proud when we have industry members, regulators, even
Yes.
investors attending a GCLS, because it's important that we have all the different stakeholders, insurance guys, healthcare administrators, everybody that plays a role in this ecosystem. They have to be educated to make the best possible decisions. And they, in turn, have to educate others, the public perception, right? So this is, of course, in many ways shaped by advertisements or the communication of companies. So I think the people working there, they also need to understand what longevity is all about. So there is, in the end, a whole shift in the perception of what we can do about our own health. So there are lots of options and possibilities for companies in the field.
Yes, great. Now let's shift to the personal perspective, right?
Yeah.
So you dedicate your life to this field, and maybe you can share with us, what is there is one longevity practice or belief that you have the biggest impact on your life, what that would be?
Well, I started studying medicine a long time ago. I switched over to pharmacy because I wanted to go more into the R&D side of things. And that to me seemed very interesting, creating new technologies. But of course, the more you read about it, etc., I see myself as a teacher first and foremost. So I get to meet tons of clever people at our conferences, our faculty, these other experts I get to meet. So I'm constantly learning new stuff. And of course, I'm asking myself, what out of that can I apply to myself? And you have to be realistic about it. You cannot do everything at once. You simply don't have the time, you don't have the money, and maybe you don't have the will. And will is an important word here. I think it's the older I get, of course, the more I care for my health because I have to. When you're younger, your body is a bit more lenient with you. Everybody knows this. Everybody says jokingly, oh, remember when I was 20, I could stay up all night, go dancing, go to a club, drink alcohol. I didn't feel a thing the next morning. When you grow older, you have to be a bit more selective. You have to change your routines and you need self-control for that. You have to eat cleaner, you have to work out smarter because it's not just more and more heavy, and you have to think about regeneration. You need a good night's sleep, maybe more importantly than you used to. You look into using gadgets to find out these are ways that I could improve my lifestyle. Taking supplements, I go to a doctor, I check my blood for the blood panel for what I'm missing in terms of the supplements that I could be taking, or I think about my nutrition way more. So this is tricky because I'm asking people to invest a lot of willpower and time into this, but eventually this is what pays off, right? So my personal longevity practice is not endorsing one thing over the other, although I would have to say there are some things that are really helpful for your body, but start by trying to become better at not forcing yourself, but enjoying to do something for your health every day.
Yes, exactly. Because doing several things at a time and trying to improve in this field and this and that and that can be overwhelming and definitely will deplete your willpower. But I like what you say, that's one things in a time, because this is how it started for me. Like for me, it started when I had some body inflammation and I was struggling with, and doctor would just like give me ibuprofen, which was not curing it at all. And then I started intermittent fasting, actually. And that's changed my life. And then after that, I start implementing different things, but one things at a time. And it may take a couple of months to really to understand how to, implement this change in your life. But one thing at a time, and then slowly it's piling up beautifully and becomes very natural, right?
Yeah. No, I
Yeah.
think that's the wonderful thing. You really feel the difference. And
Yes.
I think we have the opportunity to have great mentors that guide us along. And these can be the doctors, if they are well trained and have a good understanding in longevity science. I'm intentionally not calling longevity medicine because a lot of what we're talking about is not medicine, but it's just as relevant to your health. And this is what we are trying to impart when we do the education at GCLS, because we want people not having to find that all out on their own, because that information is out there. We talked about biohacking and trying this by trial and error, but maybe it's easier and faster for you to achieve these results by having somebody to guide you along.
Yes, exactly. So we always like to ask in this podcast, if there is like one piece of advice in longevity, what would you tell? Because there are a lot of them, but if there is one.
Yeah. Well, I think one everybody can apply is go out there and get sweaty. So be physically active, doing regular exercise of any kind. I mean, when you are an expert and you really want to optimize, you can start discussing what is the most healthy way to be active. And maybe what should be the exact percentage of you increasing muscle mass through strength training versus doing cardio work. But if you're a beginner, just get out of your seat, go out there, do something, because it typically also means that you interact with others, you have fun, you get to maybe out in the countryside, have some healthy air, you work out a healthy appetite. If you then don't choose to just eat chocolate cake, I think it's the best thing that you can do for yourself, for your body, and also mentally. And it improves your immune system, it improves sleep, digestion, whatever. So tons of medical studies out there. You have to be physically active, and that's so easy to do if you just overcome this feeling of, oh, I'm just too lazy for it.
Yes. So imagine if you're like one of the listeners of this podcast and you are getting excited about all this longevity field, maybe you can give an idea where to start. What is the first step you can do in order
Yeah.
to?
Well, that's tricky because I just bashed social media. Of course, this can be a good resource if you're a bit critical at which podcasts you want to consume. There are very good ones out there, very clever people doing them, medical experts, scientists, maybe not just the guy around the corner. Again, there are also some interesting popular science books. I think Peter Attia's Outlive has been very popular the last year or so since it was released, a very good book. So there are lots of things that you can do. If you want to do it more on a professional level, I mean, not everybody wants to do 1 year of study time dedicated to longevity science, but of course, then there is GCLS as a resource. And we also have conferences that we organize. And there are, of course, several other conferences on aging. So there is a lot happening. You just have to be maybe a bit critical to see whether the people involved there are actual experts. But there's a lot of information out there.
Yeah. This is one of the reasons why I enroll in the Geneva College of Longevity Science, because I've been reading a lot of books. I can give you like a lot of books, which I read, and scientific. And yeah, I've been in many conferences, and I just feel like I want to have this I want to educate myself into like perfect level of understanding and knowledge, let's say, not just little bit here, little bit there, little bit there. I'm trying to compare, I'm trying to see what is true. And yeah, I think like it's a great opportunity for me, and perhaps for also beauty industry, because I see that the students in the GCLS are not just doctors, which was very encouraging for me. I've seen some even beauty and wellness brands. So what if you look in the beauty wellness technology, what would you say motivate them to participate in the college?
Well, I would say it is 50% personal interest. So, of course, it's still a niche topic. I mean, it's a big trend, no question asked. We will see it being adopted across many industries, and it's already happening. And I think it's clever for companies and clinics to prepare now for that trend, because health really is the biggest luxury that we can have as humans. So, since in the Western world we have already reached a level where we can indulge in many luxuries, we move on to the next biggest challenge, and that is health, and as we grow older especially. So it's 50%, I think, still personal interest, and the rest is, of course, for people, whether it's companies or even doctors, to strategically position themselves very early on in this trend as experts. And I think this is fantastic because, as you said, you're looking for ways for this information to be organized, structured, vetted, to be certain that what you're being presented with actually has been scientifically proven. And that's the thing, of course, when you start entering into this field. It's not just that there are so many bogus claims out there and snake oil merchants selling things that don't work. It's also sometimes that you don't have yet the understanding to differentiate. So when you go to these conferences, often you have scientists, very clever guys, speaking about tremendous things that happen, but they happen in a very early stage sort of cycle of the R&D process. So it's preclinical stuff. It's things that works on cells, or maybe it does work in model organisms. Let's say a fly, a worm, a mouse. Very interesting from a scientific perspective. So I'm captivated by this, and I applaud these guys for what they are doing. But at the same time, I see normal people walking in from the street, listening to this, going out there and saying, oh, this is something that I want to apply tomorrow. Maybe I ask my doctor how to do it, and it's simply not available now. Maybe it's available in a few years. So we need this structured approach, and we need it for all the different players. We need it for the average person, for optimizing their health on a private level. We need it for medical doctors, because again, they have shown that they can, understand a lot about the human body. So they are able to filter the information out of the many scientific papers on longevity science there are, but it's easier for them, faster and better, therefore, to do it by doing courses with an organization like ours or others that have prepared that in a meaningful manner and uses a big international faculty. And then, of course, there are the corporations, and they are differentiated between the guys making the decisions, whether that's marketing or strategy, or the R&D guys, and they're also interested in education. So I'm the biggest proponent, and I tell you what, I would like to see longevity being taught in school even, because we are now at a time where we understand how we can really bring about change in the way our organism ages. Not everybody ages the same. You know that when you go to a meeting with your classmates, I don't know, 30 years after school ended, and you're saying, oh, wow, this guy, he looks really young and active. And the other one, he looks old and yeah, not very healthy. So there is a lot what you can do about individual health.
For longevity be taught in school, and maybe not all the pillars which is GCLS teach, let's say,
No,
for
of course not.
children, but some of it, for example, nutrition. I see that, I believe in schools in Japan that they teach nutrition. And how good is that?
Yeah.
Some of the parts of longevity science be taught in school is like long overdue.
I'm quite sure that in all the schools you learn about your genes, and essentially that they make up what you are, and they are immutable. You cannot change them except with gene therapy not available yet. But you're born with this. And people have the misconception that, okay, maybe some of the things that happen to me, I'm overweight, I'm this or that, I cannot change it. So it's maybe an excuse even for them. And by teaching people to understand what epigenetics is, that you have the means to effectively activate or deactivate the genes that you have available to you, and this has a much bigger impact than the actual genes that you have, but rather which of them are active. This is what makes us healthy or not. So teaching about epigenetics in school would tell children, okay, this is the exact reason why you maybe should be doing exercise, you should look after nutrition, etc.
That's great, view on that. Okay, so now, what I like about Geneva College of Longevity Science that it's incorporate the holistic perspective, as you say, like in school, but in general, beauty, health, and wellness is also looking into this holistic perspective of beauty. So maybe you can tell me, why is this approach so valuable for businesses this day? Why you should look in the holistic beauty, not just
No,
outside?
absolutely. I mean, the way we educate, we look at the different kinds of factors that are important and the interventions that are available. So there is, of course, one part that is medical slash pharmaceutical, but actually the way bigger one that we have available right now is things that affect our psyche, our body through nutrition and exercise, sleep, physical therapy. And these are all things that are available to many industries. So you can look at hospitality, which is now working on many offerings, wellness spas, of course, the whole beauty industry. Then there is supplements, so nutrition again that can help with this. So I think you need, from a health perspective, you need a holistic approach. And for companies, it's interesting because actually they can apply a lot of it, maybe with the exception of the medical aspects, for their success and for providing, their clients with some added value.
Yeah. I don't know if you have like success stories of case studies of the brands who transformed their approach in a business model after attending the college.
Yeah, well, so I'm not really at liberty to
Yes.
mention any names or companies, but as you said before, we do have many doctors as students. I think this is clear because they are early adopters and they need to educate themselves because they have patients coming up to them, challenging them, saying, "Oh, I read about it. What do you suggest?" But we also have a number of people from different levels in organizations that work in the hospitality sector, in cosmetics and supplements, even in consultancy and legal advisory. Because, of course, this extends to questions like, okay, how is this new product with its longevity claims being regulated, how we can protect our interest here? Maybe even industries like the insurance industry asks itself, if there becomes something available that would drastically increase the average life expectancy of people, this could be a huge issue for them because there are many insurances where they would then have to pay out more money or money for a longer time. I think we got tons of examples where people say, "Oh, I wanted to do a pivot for our company, focus from I would say maybe just optimizing general health to focusing on longevity in terms of supplements. We focus or redirect from beauty as in a more personal concept to looking healthy, which I think is wonderful because it does away with a lot of negative body images. So you don't need to ask yourself, oh, do I need an ultra thin model where everybody says this looks unhealthy? Or do I need to compensate with an overweight model to show that I'm, not scolding people for being overweight, but rather portraying people in a healthy fashion and set myself the target of achieving a healthy look, which is beautiful, right?
Always. Always, no matter what kind of body you have, when you see the healthy body, it's beautiful, it radiates, it shine, right?
Yeah.
It gives
But
this
at the same
energy.
time, I think we shouldn't be doing the mistake of promoting things that are not healthy, right? Only because it makes somebody feel better to tell them it's all right to be overweight, it's still not healthy. I think we should promoting things that help people, age in a way that is graceful, but at the same time allows them, to fill their lives as good as possible to go after making sports, being active, being part of a community of this is what makes them happy. And I think this is the job from all of us. And I think the industry, as in all the different industries, they have a certain responsibility and now they have a chance. So I think longevity is a huge chance for humanity.
Yes, great. I mean, I like this image of the healthy body. Just before my final question, is there something I have not asked?
Well, no, I think we covered a lot of ground here.
Yeah,
So I hope it was insightful for the viewers.
yeah,
And of course, if there are any follow-up questions or
yeah,
whatever, please let me know. I'm very happy to go into
yeah.
more detail here. It's always an issue if you have teachers ranting off on some subject. So I think any of the good questions that you put forward could have been discussed for a full hour.
Exactly.
So yeah, very happy to. I'm excited about what you are doing at the InnoCos meetings. I think it's great to bring together science and industry members because both sides learn from each other. I'm totally aware of the fact that the way you go about things in the lab is not the same as if you have to build a company and react to market trends and be realistic in what you can achieve. So this is really interesting, and it's part of this interdisciplinary, approach that we are all for. So that is
Yeah.
fantastic. Thank you for giving me the opportunity to
Oh,
participate.
thank you. Like, I'm very excited about my studies, which I'm going through right now. One of the reasons I'm doing it is because I like to help to educate beauty brands on longevity trends, and I want to help beauty and wellness industry to connect and collaborate with industry scientists, with doctors, with all the greatest minds. And in order to do that, I really need to have like a good, full understanding of this longevity science. So I see like as one of this is the best study what I could find, which is exactly fit to my needs, and I'm super excited about it. And yes, perhaps if there is anyone who is listening would like to get my feedback, please get in touch with me. I will have my contact details. Happy to share my experience so far.
No, thank you very much for endorsing it. I mean, that's the thing. If you are doing executive education, it's always a big commitment because you got responsibilities in your job, with your
Yes,
family. So we are very happy that people are willing to dedicate some of their time to it, and it's our job to make it as accessible and easy as possible, and at the same time informative and helpful to them. So for us, it's
yes,
also a journey, a wonderful one. We are very excited about also the thesis that people write at the end, because it's always meant to be useful to those people. And when they're working in a company, it sometimes has some association with what is happening there. So it's a very, very interesting thing. I enjoy it enormously, and I'm very happy that you decided to join. And
yeah,
yeah, of course, if
me
anybody
too.
is up for this, happy to discuss it, and they can reach out anytime. We have a very friendly staff that will be happy to answer their questions. And yeah, thank you.
Yeah, and I like that it's flexible, but I'm really enjoying. I'm dedicated very special mornings, for doing some of my studies, and I like that I can choose when I have time, because like my schedule sometimes gets so busy,
Of
uh,
course,
it's
of
hard
course. So
to,
it's
yeah.
it's maybe for those people watching. It's a 1 year program, the
Yes,
Executive Masters in Longevity Science. It has 10 courses essentially that are split up into different
It's
modules
12
at the end.
hours.
that's me. That's my computer.
Yeah, well, I mean, it's everything is online. We do have our physical meetups every half a year because that is important to build connections between the students and the faculty and between the professionals that are part of this. But at the same time, we know that we got people from 5 continents attending. So we have to be flexible. We have to offer a lot of pre-recorded material. When we have live webinars, we again record it, make it available, because everybody is different in terms of their needs, as in how much time they can dedicate to the program. And so therefore executive education is completely different to having maybe 20-year-olds all in a room together and being able to do nothing else for 5 years than to focus on one topic. So it may be a bit harder to prepare the materials in the right way, but it's also very rewarding because everybody comes and has stories, and I think everybody attending is sort of their own expert. So it's sometimes working in both ways. We educate each other.
Yeah, and I like how global the audience is, because my personal network is also international, because I find we can learn a lot from when we have more multinational, international kind of participants, right?
Absolutely.
Yes. Okay. So thank you very much. That was it. I think we did very well in time, actually a little bit more, which is great. So thank you very much. I hope to see you soon in Dubai. And for all of our followers, please, I will have some more information about Geneva College of Longevity Science in the descriptions. And see you soon for the next episode.
Thank you very much.
Hold on. Still recording. Oh, it's not stopping. Anyway, I'm gonna cut it. Stop here.